I thank his organizing team and everything. A few words about Satish. Wherever the Satish is there, something will be happening there. He is like a vibrant. He is not a calm person. He is always a vibrant. Something will be happening around him, either in form of CME or a conference or some workshop or something. This is we all are witnessed regarding the Satish. And not only that, academic is a good administrator. I had a good opportunity to work with him for last 8 years in Mahatma Medical College and Research Institute, Sri Balachandra Pondicherry. So whatever, not only that academic part, he's a very good administrator. I think most of them don't know that about Satish. He was a right hand of the controller of examiner and he was the assistant controller of examiner for a long period. I think more than 4 years and the deputy controller of examiner. The entire university was run by Dr. Satish. And he is a very good mentor. You know that he is molding the student future doctors, but he is very strict in discipline. That is about this student to that is the molding of future doctors. And you know that Dr. Satish is a computer Lisa. But your problem is there in that department when you will inform to the IT before that Satish will rectify the problem that is over the IT people will come and return. That is, I am saying this is that Satish is all rounder. So wherever he is there, that is definitely something will be happening, and the faculty will learn a lot from the studies. Thank you, Satish. Thank you for the opportunity. Just I will share my that is a research experience knowledge regarding this in this form. Okay. So this is my that is discussion learning objectives. Just I will give an outline about what is translational research and what is translational research in anatomy, and I will give some few examples. So what is translational research? So the process of turning observations in the laboratory, in the clinic, and the community into interventions that improve the health of the individuals and the public. And from diagnostic and therapeutics to the medical procedure and behavior. So very important that the observations turning into translate your observation into intervention. That is translation research. This can happen in the clinic or in the community or in your dissection lab or in the engineering. So we are turning the observation into intervention. I will share a real life scenario that is the last year batch that is there posted for FA, Family Adoption Program, that we have to have 5 villages. So that is near Klashikram, our place where the institute is there. The 5 villages they are adopted. In that one village, when the student entered into the family to interrogate, they said that is a cluster of, in that particular village, a cluster of families having the same complaint. The complaint was they are having frequent sneezing, and that is the nasal congestion. They can't breathe. They have a breathing difficulty. Some they are having wheezing. Those who are sick immediately getting the same bus. The students transported the same bus. They got to the hospital, and they were treated. Unfortunately, there one student was there. That student is already completed that BSMS, basic that is the Bachelor of Siddha Medicine and Surgical Science. Is completed now. He is being MBBS. He found that in the cluster of family surrounding area, the dry area, there is a plant that is named. It is a Parthenium plant. So he already knows about that plant. This plant is the one causing that is allergic. And when he reported to that the accompanying faculty in the community medicine, then he is not believing that, but he strongly says, no sir, this is the plant. When the plant will grow, it will flower. That flower, when the time the flower will come, that time they will have that suffering. Then in the end, they enquired that is the plant was there nearly for more than 2 years in that. Okay, the faculty said, requested that family, that village people, that is, can you remove all these plants? They said, okay, immediately within 2 days, they have a lot of village people, they have removed that entire, that uprooted that plant and they burned it. Those people, they are transported to the hospital, they were in the ENT department and in the pulmonary department, they were examined, they were taken the blood, their IgE levels were highly increased, that is the isophilic component, that is also highly increased. They were treated with the decongestion and that is the antiosmotics. Then they returned back to the community. Within 1 week, what a surprise! The next field visit, They all are symptom free. Nearly 90% of people are symptom free. So this is where that is the family adoption program is working there in the for the community. So just they found an observation. So this is the thing. The intervention has been done. That's all. The preventing that such a thing. So that is, this is like a one form or example of that is the transnational research. The main goal is to move from the basic that is science discoveries more quickly and into that is efficiently into the practice. So that is the main goal of this transnational research. The research, transnational research, it has 5 stages. When concerned to the anatomy or the basic science, that our research will be in the stage of the T0. That is, there are 5 stages, T0 to T4. That is the T0 stage is that is the basic science research. Here that is the mainly that is the animal studies, the preclinical studies, that animal studies. For example, if you want to test a drug molecule, or there is a new that is a diagnostic tool or something, you are designing that, defining that mechanism. Okay, that is what is the target perfect people. Okay, and what is the lead molecule. So that is in the T0 stage. Then you have that is the idea what you are going to do. Okay, or say that is a new tool or the drug. Now you are going to apply into the T1 stage, that is translation to the human. You are planning for that is the conduct the study in the what type of that is the population you can select and such. So the already you have designed that that is the mechanism, the concept, everything you are going to apply. So here it is that there is a new method of diagnostic. It can be a treatment or it can be a prevention. That is the T1 stage. Next is that is the T2 stage. That is the translation to the patient. Here that is the one control group will be there and one study group, that is the disease group will be there. We are comparing that for that the knowledge of the concept into that. So this is the control stage. So these 3 stages, T0 to T2, it will be happening here in the that is the basic science department. Transition from basic science to the human study. Now come to the T3 stage, that is translation into the that is the practice. So that is ideally that is the clinical trial phase 3 and 4 will be that is the involving side. That is the 4 will be involving here. Phase 2 and 2 will be the T2. So here in the phase 3, T3, that is the phase 4 clinical trial. We are doing that in the outcome of that is the study we are mainly doing here. Okay. So now that when it comes to that, that is the T4 stage, it is translation to the community. A particular tool or particular drug is in the practice, and now we are that is assessing its that is the benefit, whether what the changes has happened because of the either drug or the. So that is here in the population level of. So these two, that is the T3 and T4 stage, we are calling it is that is the translation of the new data into the clinic and the health disease. So this that is the 5 stages in the translational research. Now come to what is translational research in anatomy. As I mentioned, that is the translation research. The same thing here, that turning the process of observation in the either in the dissection lab or in the that is the procedure in the cadaveric lab, okay, any endoscopic or whatever procedure, and in histology and in genetics lab into interventions that will improve the health of the individuals and the public. So that is the definition for that translation research in anatomy. We are doing with the students are there, we are doing in the dissection. That is, we are observing some variation, some important thing. That is, we are bringing. This is actually that is from the bench to bedside. That observation we are reporting here, the publication. That is the research is involved. So here the scientific knowledge gathered via anatomical research is being used to create workable solutions for enhancing the human health and medical. This is the integration from the bench to that is the bedside. So we are bridging the gap between the basic anatomical research and real world applications. We have heard that is a lot of ICMR project and the STS project that the students used to come. Because that is when they will finish the first year, they will have a good attachment with the first year faculty. And whenever that students will come, usually that faculty used to say, oh, no, STS ICMR project can't be done in anatomy. You can go to the either to the community medicine or to the biochemistry. No, it's not saying you can do that research. itself, that is in the anatomy itself we can do. What they are doing in the dissection, some observation. They have lot of ideas. Students are having that is the more than us, they can they have a lot of ideas. So something in what they are observing in the dissection or in the histology. And the embryology, a lot of things we can be done in the embryological aspect. And the genetics also, we can do that. I'll give some of the examples here, a few examples just I will quote here. So, in the field of clinical anatomy, researchers may use an anatomical knowledge to improve the surgical technique, medical imaging, and diagnostic procedures. Or as given here, there is a good that is talk about that is how the ultrasonogram has been utilized for the anesthesia and surgery. So that is one of that is a clinical anatomy that we can use. This is another one example that is a 3D printing technology has been applied for creating a patient-specific anatomic model. For example, we want to do that is a emergency procedure, say that is a cricothyroidectomy or emergency endotracheal intubation and such a thing. The real-time model can be created, the cricothyroidectomy membrane can be created in a model that you can print it, give to the surgeon or the people when they want, they can do it. So that is the applied anatomy is here, we can use it. And the disease research. Anatomical studies can contribute to the understanding the causes and mechanism of the disease. This knowledge can lead to development of the targeted therapies and the interventions. So one of the examples is that is the deep brain stimulation for the Parkinson's. They must know that is the anatomy of that is the basal deep brain, where there is the dopamine, that is the striatoneural fibers. So that is where to give it, that is the implant, that is the deep brain stimulation. That comes from this translation. One more example, that is the left ventricular assist devices. For a failed left ventricular, we can surgical procedure, we can do that. So that is another example for the disease. Drug delivery, everybody might have heard about that is a targeted drug delivery system, isn't it? So that is it can be used for that is for effective use of that. Especially that is the uterine artery embolization for a fibroid uterus. Nowadays, that is the stent we are keeping that is in the occluded vessel, the coronary vessel. That is in the long run we have heard only that is the angioplasty. Now that is the balloon angioplasty is to be replaced by the stent. Now that is stent is eluting, that is a drug eluting stent. So to prevent the further that is the atherosclerosis or the blood clot. Nowadays that is everything has gone because of the advancement and now that laser they are injecting that is a laser and to dissolve the clot immediately within a few seconds, few minutes of that is dissolving that is the patient will be absolutely gone. So such a thing should be utilized by this translational research. But for the anatomical education now that is a lot of changes in the anatomy, isn't it? The recent days, everybody agree with me? There is a lot of changes in the anatomy. There are changes. Drastic changes. The changes in that the anatomy is same. The body structure is same. God has created a wonderful human body. It is same for years and years. But the way of teaching and learning anatomy has a lot of changes. Nowadays, that is the new method. That is the anatomy, the cyber anatomy. So many things have come, isn't it? The teaching students also like that. They want that is a digital. They are born with the digital and that continuing. They like that one. Okay, but none can replace the dissection, isn't it? Everybody, all anatomists will agree that they can feel that how the artery, how the vein, that the in situ view, the three-dimensional view. That is what is the relation of the endowed abdomen, opened abdomen. What are the structures that closely related? Such a thing, wonderful idea. That is wonderful feeling. That is never get in a dissection. Whatever that is anatomy, whatever software can come, even that is the real anatomy software, such a things are created, but none can replace. Now, this is another thing, that is for the advantage of translational research in anatomy, rehabilitation and prosthetics. So here we can, that is you must know that the detailed morphometry of that, for example, the knee joint and the hip joint. Lot of studies, lot of articles are there. The reason because what we are using the prosthesis is either made in USA or from the Germany. So there, that morphometry of their knee joint and the hip joint, they have done a study on the basis of their morphology. They are manufacturing that prosthesis. But most of the orthopedians are not familiar with, not good with that the use or the important one. So that orthopedicians are related with our Indian students to do the morphometry of the Indian context of the tibia and the femur, and there is the hip joint. So now that is we are going to manufacture that prosthesis based on the Indian morphometry. That will exactly fit, and that is it will good with the those who are suffering from that is arthropathies. So this is some of the example. So I will give most of the two areas, that is one is the grass anatomy, another one is the in the dissection, or another one is that is in the histology. Thereafter that is doing lot of spending most of the time there. I will give two examples what we have done in our that is the institute. Okay. So how we started the research, why this question has arisen, what is what was going on, and where we entered, what are the limitations and such a thing. Just I will give a few slides, I will explain. So this is just we found a gap. That is we have identified a problem. That is the ICMR says that there was contradictory scientific reports on radio frequency radiation of biological tissue. Radio frequency radiation is emitted mainly from the cell phone. That is it has a contradictory scientific reports. The WHO and IARC classified the cell phone radiation RFR emitted from the cell phone is that is the category 2B. It means possibly it is carcinogenic to the. So ICMR initiated a study in the Delhi actually on the to find out that its adverse effect on the. So ICMR has cited that no conclusive, that is the paper. So no conclusive data or evidence so far to show that radiation from the mobile phone or towers, cell phone towers have adverse health effects. So ICMR started a study to emphasize that need for the further investigation to find out whether radio frequency radiation is inducing that is the health effects. We found that is this study will be that is we have to conduct the study on that. ICMR is doing that is it will report will come, it will take year now. We thought okay we'll do an animal study because in anatomy we can do only that one. The basic T0 level only we can do that. So we started that to study because in nowadays that is when the baby is inside the uterus, all the pregnant mothers are all using the cell phone. So from the day one, that is the baby, the embryo is exposed to the cell phone radiation. And the teenager and adult probably no need to say. The font of gadgets are more on children, especially the Indians. They are always in the cell phone. And the other day, till old age, till death, from day one to till death, we are with the gadgets. Whether these radio frequency radiations are affecting the cell, our health or not. So we have gone through the review of the literature. There is a diversity of the reports. So the mobile phone radiation causes single and double stranded DNA breakages. The reduction of protein cells number in the rat cerebellum, significant reduction in the sperm count, reduction in serum testosterone levels, short-term memory effects in the mice, short-term exposure induced damages in the kidney. And in the human volunteers, the 10 years exposure will lead to risk of acoustic neuropathy and reduced reaction speed, reflex speed, increase in both systolic and diastolic pressure, genome affecting the human peripheral blood glucose, decrease in the sperm count, motility, and viability. This is where we should keep our cell phone. That is being well. That is when you keep your cell phone in the pocket, it may interfere with the conducting system of the heart. Studies have shown that is the extrasystole, and that is the cardiac arrhythmia. Usually, that is the atrial fibrillation. Very difficult to treat the atrial fibrillation. So these are induced by that is the cell phone radiation. So when you are keeping that cell phone near in the usually that the belt clip will be there. When you keep that, it is reducing the sperm count. When you keep here pocket, it goes there again. That is the reduction the testosterone level as well as that is the sperm count. Where to keep the safe place? When I did this research, And when I presented, they asked me, so then where would you keep the cell phone? Keep going on that is the over the buttocks, that's the very safe place. Only that is the group is maximus and minimus is good. Getting radiation doesn't matter. For female, no problem. Yes, sir. For female, no problem, you can keep it anywhere because the ovary is in safe intra-abdominal, it is very safe. You can keep anywhere, but not except close to the heart. Our study has found out that one also, they confirm that ovary is safe, there is no changes. Okay, so that is the thing. Some contradictory scientific report is also there. No breakage on this double-stranded DNA of a rat brain. No effect on mouse brain, mouse embryonic lens development. No effect on psychomotor performance. No histological changes on rat. So we started to, that is with this basic idea we started to, that is the cell phone research. So this study was started actually in 2010, supposed to end by 2014, but somehow it is extended to 2016. That time we have conducted the study on the 2G cell phone and the 3G cell phone. That time only that emergence of 3G cell phone. Now that is in the I have that is the 3 PhD scholars. Now they have conducted and completed the research on the 4G cell phone. Now that is the last year that our scholars they started 5G with the emergence of 5G. Now they are doing that research on the 5G. Now I am planning for next that is the 5G plus also. I have that is so the last research last year that is we have given that is some plant extract and antioxidants to reversal of that cell phone damage. So just here I am simply presenting only that is the 2G cell phone and the 3G cell phone. Okay, that is my study finding. So this is this study that is on the postnatal effects of the radiofrequency radiation exposure 2G and 3G cell phone from 0 to 180 days. Okay, so that is
how much duration?
Yeah, very good. Okay, so to identify that gross anomalies occur due to radiofrequency exposure from 2G and 3G cell phone on, where mainly in the brain only we took only the hippocampal region. We thought of that is that we are using that cell phone and the memory will be affected like that. Only we have only that took that only the hippocampal region of the brain and the entire liver, kidney, testis, and ovary of the mice. Okay. So you want to know that is the severity of structural damages caused by this RF exposure on the solid organisms. And we want to analyze the structural changes in quantitative terms using that is the stereological and histomorphometric data to prove the potential damage caused by the RF radiation. We want to evaluate that is the oxidative stress because that articles are saying that is that the cell phone inducing that is the oxidative stress. So we want to do that one also. That is the two important enzymes that is the superoxide dismutase and the GPX. Then we have done that is whether there is any the alteration in the protein. So we have done the single dimensional SDS page analysis. So this is a simple that is we have adopted that is the alkali method. There are a lot of methods are there that is for the dosimetry. We have adopted alkali because we are not under that is the covered radiation protected area. So we are simply using in a common free environment. So that is the same method we have adopted. So here you can see the cell phone, the 2G and the 3G cell phone will be there. Animals are inside, the mice is there, albino, white albino mice. This is the radio frequency exposure. The mice will be free to go in here and there. The cell phone was kept inside and the mice cannot enter the car. So we have a device that is when you will give the 2 ring, then automatically auto answer will be there. Or in the video call, the 3G, when we use that is the video call. When after the 2 ring, that's automatically the video call will be so open. Then you can see that mice is moving here and there if you come to the cell phone upside down. Okay, so this is the radio frequency meter. That is, it will measure how much radiation is exposed to that is the mice. That measurement will come. There is a different level is there. That is, if it is the red, it is that is the high frequency. So this is the dosimetry. That is, we have used that is the for 2G 900 to 1800 megahertz frequency, and for 3G 1900 to 2000. 2200 megahertz, and the power of the cell phone is 2 watts. And the this is very important. The specific absorption rate should be that is for the device it is 1.69 watts per 10 gram of tissue. This is when you are using that cell phone, that is per 10 gram of tissue, how much radiation is absorbed. That is specific absorption rate. When you are purchasing the mobile, it should be that the value will be around 1.69 or less than that. If it will be more, then it will be a more damage. Okay. The duration of the exposure, that is ma'am asked, the duration of the exposure is, that is once in a half an hour, that is we are exposed for 2 minutes. So totally the experiment will start from morning 8 to till evening 8. So that is totally that is a 48 minutes exposure we have. So that time that is we have that is conducted a survey. So what is how much average time of that is the cell phone you are using? We have encoded. We are giving questionnaire. That is we are collecting lot of information from that average use of the cell phone. Then only we are using that. So almost nearly 40. Nowadays, 45 minutes is very less. Nearly that is the 4 hours, 6 hours continuously on the cell phone. Okay. So nowadays that is we are changing the exposure time also. So this is what we have studied that this is in the brain, what effect that is the hippocampal region. That is here that you can see the hippocampal region, which is the cornea minus 1, this is the cornea minus 2 region, and this is CA3 region. This is the dentate gyrus dorsal plate, and this is the dentate gyrus frontal plate. We will see the neurons there. Okay, so that is. So in this region we have conducted study. So we have measured that nuclear diameter by using that is the calibrated arc micrometer, and the neuronal density also by that is the each region we have measured the neural density, and we have used that capture device, that J-Wave software. So we are in the kidney, that is we have used that, we have measured that is the diameter of the glomerulus, the diameter of the urinary glomerular urinary space, the diameter of the TCT and the DCT also. In the testis, that is the diameter of the seminiferous tubule and its density, the average number of the Sertoli cells in each seminiferous tubule, and the average number of the that is the latex cells. And in the that is this is our observations. Of course, we have done in the liver also. That is I will show you later. So this is our observations. That is the SAM exposed. This is the 2G and 3G. You can see that is obviously you can see that less number of the neurons in that is the pyramidal neuron in that is the cornea minus region 1. This is of course that is the totally diffuse time, the same thing. This is CA2 region, that is again once again this is the sham exposed lens densely back neuron, and the wide interstitium will be there. And this is the CA3 region, that is not much changes in the that is the CA3 region. And this is dentate gyrus, that is the dorsal plate. You can see that is the granular neuron, not much changes. And similarly here also that is the ventral plate also not much changes. And of course this is the silver stain to identify that is the nerve fibers also. That is. So the study has been published already. Now this is in the liver, that is you can see the normal liver and the 2G and 3G exposed liver. That is, we found lot of that is the cytoplasmic vacuolations, that is the foamy spaces, and that is the many hepatocytes, so that the pyknotic nucleus, that is indicating that is the apoptosis cell death. Okay, and that is hepatic sinusoids are usually that is the congested and dilated. Okay, in the 3G that all the changes are more marked, and in the parenchyma, lot of that is the focal hemorrhages. It will be more marked hemorrhages in the 3G. These hemorrhages due to that is the radio frequency radiation induced, that is the endothelial permeability, the endothelial damage that will lead to that more marked hemorrhages. And so what we have observed in the parenchyma is that is around the periportal region, that is inflammatory infiltration that mainly consists of the lymphocytes and the macrophages and the neutrophils. This more marked lymphatic infiltration, sometimes that is the nodal formation is also there in the region. So these all are based on that because of that is inducing endothelial damage and due to that is the. So this is on the kidney, that is the sham exposed. This is the 2G and 3G. In the 2G, what happened that is the diameter of the glomerulus is increased, the urinary space is also increased, but the contradictory to that higher frequency radiation, what happened that is that the glomerulus is going for atrophy, and what is that the congested glomerular capillaries, the urinary space is also reduced. The urinary space is increased because of that in the low frequency radiation that it is increasing that vascular permeability through the filtration. So that's why that urinary space is increased. So in the parenchyma, that is once again, that is you can see that is the peritubular and the perivascular lymphocytic infiltration. You can see that is a huge lymphatic node formation was observed. This is once again that is it's a blood vessel. Okay, along that you can see the lymphatic infiltration. So this is around the peritubular, that is a lymphatic aggregations are observed. So once again, that is you can see the hemorrhages into the parenchyma. That is the blood vessels are congested. This regarding the conductive tubules, you can see the proximal conductive tubule, the breast border will be discontinuous and the lumen, because that is the breast border is disappeared, that is the lumen will be looks like white. And the cell so that is the cytoplasmic vacuolation and the pyknotic nuclei, okay, more marked changes on the 3G. And here also once again that is the peritubular as well as that is the, see there is a huge lymphatic aggregation like a nodular model. This is a distal conductive tubule, only that is the vacuolation and the pyknotic nucleus are there, indicating that that is the radiation induced damages. This is on the, that is the testis, okay. So you can see the compactness of that is the seminiferous tubules, okay. So you notice that the capsule will be apparent thickness, okay. The intertissue you can see that is the, here it is a compactly packed, okay. So here you can see that is the intertissue will be appears wider. Okay, that is here also of course. So that is the thickness, that is the standard for that. You can see that the thickness, normal thickness here you can see that is the thickness will be reduced in the seminiferous epithelium. That is you can see the spaces, the more spaces, mainly here that the periphery of the tubules are more affected. The center it is okay. So it indicates that is the radiation exposure involving that is the seminiferous, the periphery of the seminiferous tubules. Okay, so you can see that is the detachment of that seminiferous epithelium from the basement membrane. Okay, so the 3G will show that is the extensive damages. As usual, that is all the cells in that with the vascular degeneration, with the pyknotic nuclei and everything. Okay, so mainly the changes you can see that is the changes mainly in the periphery. This is a capsule, that is the periphery of the tubules are mainly affected. We have done that is the Johnson testicular biopsy. So for the 2G it is coming only, and the 8 and 9, and 3G it is reduced, it is almost coming to 9. Okay, most of that is the cells are vacant. So we found out that is there in the ovary, or is there any changes, but there is no significant changes on the ovarian follicle, starting from primordial follicle to all that is all the secondary and tertiary follicles, all are normal, meaning that this reason that it is well protected in the intra-abdomen. And we did that is the SDS page, that is analysis. We have noted that is that there is a degrees there, 17, sorry, the 97 point kDa, 4 kDa was degrees, and 29 kDa, that is the protein has, that is the expressions are uncommitted. The 66 protein expressed in the higher level, these all are indicating there is a expression in the, that is the changes in the, this kDa protein indicates that is a damage. So we conclude that our study, that is with the following recommendation, that is it is logical to minimize the cell phone use in children and teenagers until further research on long-term exposure to RFR from cell phones are published. Hand-free devices such as the Bluetooth can be used to avoid thermal stress and anxiety. So using a Bluetooth, again that is it is receiving that, but only thing you can avoid the direct heat from the cell phone. The heat, the thermal stress only we can avoid. Using Bluetooth also the same thing. That is, it is through the RFR only it is going to work. Okay. Now use a cell phone close to the tower. Then the transmitting signal will be very high. Similarly, that is the when the signal is very low in the your cell tower, in your cell phone tower, then better don't get. The cell phone will try to extract more radio frequency when there is a signal in the okay. So children would be that allowed to play mobile games in here after putting in here. That is the there are some limitations are there for our study. That is, these are some limitations. Direct extrapolation of the outcome of the present study to the human population may be limited because of this region due to differences in the species, the volume and size, lifespan, the function and anatomical organization of the tissues, the duration of the exposure, the frequency and intensity of transmission, the shape and the size of the exposed organ, the water and mineral content of the organ, and also the distance from the radiation source. Okay, so that limitation we have given, and this of course that is there was we have done only whether that is we started with whether that is the radiation is inducing there is any harmful effect. Then in the next thing that is we started with the 3G and 4G whether the reversibility is there or not. After withdrawal exposure whether the reversibility is there. All these cell phone damages, most of the cell phone damages when withdrawing the cell phone it is reversible. And we have identified some other plants that is somnia, there is such a plant extract and the antioxidant we are giving to reduce the stress level, and that is with that along with the exposure there is we come out with that is there is some positive findings with that the plant extract as well as the antioxidants. Okay, so this is one side, and now that is whether is it possible to do that same experiment in the human being means it is lot of hurdles are there. But even though that is SMR is conducting a study, the living people it is very difficult to get a control. Everybody is using cell phone. And how to compare that is a very one of the important drawback. And in a living population, for example, 10 years or 20 years of use of cell phone, then taking a biopsy from your brain and or it will be a little bit difficult and the ethical issues also. All of there, that is that is the research is going on. That is to find out that is the harmful effect and everything. One more observation I will tell you, that is when I was doing that is my postgraduate in Madras Medical College. One of my colleagues that is he was doing that is the gastroenterology, MCH gastroenterology. So he came to our department and he said that is Dr. Whenever that is we are doing that is the partial hepatectomy, either the left lobe segment 2 or 3, 3 or 4, or the 5 to 8 segment hepatectomy. That is, we are finding some. We have that vascular pedigree. We are assessing some other vascular pedigree also. We are ligating, but I don't know that. But we are doing because we have cartilage. Whatever vessel will ligate it, we are going to remove it. Whatever vessel is being cartilage. So we are doing. But I want to know that what is that any abnormality and such a thing. That motivated me to do that search on that the vascular blood supply of the entire upper abdominal organ, including that is the celiac and superior mesenteric artery, of course that inferior mesenteric artery. Still that we are continuing that study. Almost I have changed the 3 institute, but I am continuing that still that study. Now just to show you that some of the things that is, don't think that is what we are observing in the dissection or one variation just presenting a case report. This is we may say that this is enough like that, but it is not enough. Of course, this is the research we can do in as anatomists. We are taking into to the surgeons. We are notifying them these are the variation and everything. Now that is the surgeons they are on the anatomical background, they are performing the surgery and the patients are getting benefited and patients mean the communities are getting. So we are in the link of the translational research, either at the T0 level or T1 level. So we are that is completing that translational research. So we are our observation putting into the interventions. So we are not delivering directly to the community, but through the surgeons it is we are delivering that that interventions into the benefit of the public. Okay, just a few observations. So this is what I said. We have completed that 4G WiMAX everything we have completed. 5G also is going on and nearing the end stage. 5G plus we are going to start. Okay. So this is what I said. Everybody knows that when you are observing the picture, you know that isn't it? The celiac tract, the tripod of Lala, it will always give the only 3 branches. That is the left gastric artery. Okay. So this is the esophageal branch. This is the gastric branch. This is the common hepatic artery. Okay. So this is the gastroduodenal artery, proper hepatic artery giving the right gastric artery, and right and left hepatic artery. Of course, cystic artery is arising from the Gallus triangle you can find. Okay, it's a normal. Okay, so what is that vascular pedicle for the surgeon? Okay, doesn't matter whatever. Anyway, they are going to resect. So they won't matter about okay, whatever blood vessel is there, they will like it and they will cut it and go. But this particular surgeon has insisted me. That's why it is motivated me to do a lot of research on that. Still we are doing that. A lot of pictures are there, lot of variations are there, just I am projecting. Lot of paper also we have published, but only a few things I will just to share with you. So this is celiac tract, of course, typical tripod of Allen, sphenic artery, the left gastric artery, that the common hepatic artery is the proper one. The proper hepatic artery is going to divide into a small branch, that is the, and call it is the middle hepatic artery and the right hepatic artery. Okay. So here there is a absent left hepatic artery. Now the left hepatic artery is coming from, you see, that is the left gastric artery. That is giving that gastric branch. Okay. So this is the actually that branch is coming to here to supply the entire. That is the, so being here it is the left hepatic artery is absent. We are naming it is a replaced left hepatic artery. So it is the entire soul blood supply of the left lobe is depending on this vessel, so it is called, that is the replaced left hepatic artery. The surgeon must be aware that. This is one of the postmortem specimen. We are digging all the whatever. If we have a forensic faculty colleague, then we will get a lot of specimen. One of the specimen, really we have dissected more than 15-20. Lot of ethical issues there, but even though we are dissecting that, you can see that the celiac tract will end into the only two branches. It's not a typical tripod of Haller, only that is the sphenic artery and the left hepatic artery. So that is the left gastric, from there that is the hepatic artery. See, that is this is named left gastric, and then it is going to supply the hepatic. So this is the superior mesenteric artery. From there, that is the right hepatic artery is coming. This is the replaced right hepatic artery. The sole blood supply is from the superior mesenteric artery. So here you can see here, typical tripod of Haller only. The common hepatic artery, giving proper hepatic artery, giving a left hepatic, okay, and a small branch, that is the middle hepatic, is very that, okay. So this is the branch from the proper hepatic, that is the right gastric artery. Now you can see the superior mesenteric artery. From there, the entire, that is the right hepatic artery is arising from there. There is a replaced right hepatic artery. See the left gastric artery, the gastric branch, here that is, you see that another branch is entering into the liver porta branch. You see here. That is, it is already a left hepatic artery is there. So this is their naming accessory left hepatic artery. But here it is that is a replaced right hepatic artery. There is no right hepatic artery coming from the proper hepatic artery. Okay, such a variation. This is everybody knows that this typical normal only. The right hepatic artery making here, what is that? The caterpillar hump or Gorian hump. So this is very important for a surgeon when doing, that is the laparoscopic or open cholecystectomy. So sometimes if the calibre of that right hepatic artery, if the hump will be very less, they will mistakenly take it as a cystic artery and they will like it. So that is the important thing here. So this is once again that is with the moderate caliber, that is the right hepatic artery forming a Modigan. So this is retrospectively we have examined that angiogram of the superior mesenteric artery and the celiac artery, and we found that is you can see that superior mesenteric artery angiogram showing that, and they replaced right hepatic artery, and from there that is the cystic artery. So this is a typical tripod of Haller. You can see that there is a left gastric artery, it is giving that is a replaced left hepatic artery. So the proper hepatic artery will give only the right hepatic artery. The left one is coming from the left gastric. That is a replaced. Okay. So that is such a thing that is you can observe and intimate. So it will be your observation will be very helpful for the surgeons and imaging sonologists. Okay. So the next that is a safe procedures on the patient, and the patient will get connected. To sum up, so we are turning our observations into the interventions, and that ultimately we are going to benefit, that is the health of the individual. This is we have found also we have done a study on, that is the chick embryo. We want to study that is in the chick embryo in the inside. During the embryonic period, any study any damage is there. We have done that study also. With the combined all our studies we have intimated to the that is to the public. This is it was in the Indian Express. It was our research finding was expressed. Excessive use of mobile phone during pregnancy and childbirth is harmful find a study. So that is the article was published in the newspaper. And of course, this is what I have shown, that is for the interest of that surgeon and the clinicians, our observations here. So to sum up that, the translational research in anatomy aims to apply anatomical knowledge to solve real-world medical problems and enhance the patient care through improved diagnostic treatments and medical procedures. I'll be happy if you have any other questions or something. Yes, thank you.
Is that the studies on the, like you put the mice or also on like you deliver and the small mice is?
No, ma'am, this is our studies,
Adult.
yes, from the up to 180 days only that is. They are collecting the neonatal mice from the veterinary college and we are randomized controlled trial. Randomly dividing into.
And at what day you sacrifice them and?
Yeah, actually that is our ethical committee has allowed for us 144 mice. For this study purpose,
Not
we are
45 mice, I'm asking what is the duration? Like for how many days they are?
yes, madam. That is actually we are dividing into that is the 6 months in each group. That at the end of the 30 days exposure we will sacrifice. Then at the end of the 60 days we will sacrifice a group. You have to see the
So
samples.
60 days you are keeping, exposing them and then you sacrifice
Yes,
the mice?
30 days at the end of the first month to 6 months. At
And
the end of every month we will sacrifice.
okay.
Just I have presented the research. That is only the findings, what are the things.
Yeah,
I'm
yeah,
not saying
I
that at the one, what is the changes at the 1 month and the 2 month. It will be a long process.
No, like then you collect the brain tissue,
Yes, ma'am.
then we have to wait for
Yeah,
procedure
immediately process.
or immediately.
Can process it?
Okay.
Technically, everyone knows that it's
No,
process.
I have similar study on suicidal mice, but
Okay.
in BHU we used to preserve that for some time, the brain tissue, and then we used to process. That's why I wanted to know what is the difference because mine is on the drugs.
Only that enzyme study. Only that is the enzyme study.
Okay.
And the serum, when we are taking the blood for serum, testosterone. We
Okay.
have done that serum testosterone study also. That is the antioxidant study. Everything I have not presented it. For
Okay.
that purpose only, we have preserved in the teach with the minds community. Otherwise, everything morning 9 o'clock, before 9 o'clock, we complete the study, immediately we process it. Next day we do.
Okay.
Yes, we are scheduled.
Because it's a very semi-liquid type of thing.
Especially that is the brain and the testis will be
Yeah.
little bit
Yeah.
difficult. Otherwise, everything will be.
Yeah. Okay. Yeah, liver will be fine.
Yeah, liver, kidney and.
Liver, kidney. Okay, thank you.
Very nice presentation, Dr. Suman.
Thank you, sir.
And in present scenario, NMC has accumulated for anatomy to teach more of clinical than old anatomy study which you had done. Very nice transitional style. और आपके स्टडी से तो यही लगता है क्लिनिशियन को कि आप पेशेंट को क्या खाते हो क्या पीते हो उसके अलावा कितना होगा मोबाइल कितना देर चला you have to come study on each and every organ से सारा बहुत सारा चीज है ना तो it's good nice any question कुछ पूछना है
Sir, I just want to know that you have done the testis histology, and you also told that there is some changes at genetic level, and you reported that females should during pregnancy should take care of less use of mobile phones.
Yes, sir, that is now.
But testicular changes are more as compared to ovarian changes. And nowadays we also know that if there are seminal changes or testicular changes, it can affect the further generation. So I think men should also take care of less use of if it is affecting the testicular.
Yes, sir, we need, that is actually the generation, those who are using that is cell phone, whatever their descendants, say that since birth they are using the cell phone, that is, we have to do, conduct a more research. Then similarly, sir, the basic thing is, the cell which is rapidly dividing is more prone. That is damage. Especially that is, you know, that within 64 days, that is the cycle will be a little bit fast. And similarly, that is GAT, the epithelium in the GAT. So actually, what I want to say that is that when we are talking about the research, it looks like and from outside, okay, everything is going on smooth and everything, but really the researcher, how they are suffering is you only know. You hardly know that because as a researcher, I can say that is, for example, while doing the research, I was starting it is very comfortably. I was doing the research everything. Research, unfortunately, it is extending, and almost 6 years. And the research, when we started, we are exposing to the cell phone because it's not only one cell phone that is you are giving a ring. So you have a 5 set of cage for the 2G and 5 set of that is the cell phone for that is 3G. I have to give a call for every half an hour, 2 minutes, or 2 minutes, next to 2, next to 3, 4, 5, then again I will be continuously giving a ring. And you see that the researcher, I am exposed to the cell phone radiation more than you, sir. You see that the duck is on the water, it is sailing smoothly. Everybody will be happy, oh, see the duck is smoothing. But how much it is struggling that in the leg with for smooth is only the researcher studies. Because while doing because the purpose why I have delayed the research, I will tell you that is why during that research, so far I was very comfortable. Suddenly one day I have admitted with a severe that is abdominal pain. The casualty they took that is the X-ray and everything in the X-ray showing that it is a subacute intestinal obstruction. Okay, the fluid level, gas everything there. Ultrasound has been done, MRI everything has been done. That is they have given so many medicines and everything. Oh, Bhascopan, so many things, everything. Finally, that is they have given that is the tramadol. That within a 5-10 minutes I have been leave. So I underwent that is the endoscopy. They took that is the biopsy, and the report came as lymphocytic infiltration. That is the anal gastritis and lymphocytic infiltration, etc. And during the time, my abdominal will that is the distension. I will have vomiting and everything. Why I am telling this? But during the study, I found there are 2 mice like that. The abdomen was very distended. And I thought maybe it is initially I thought maybe it is pregnant like that. One of the female that it was the abdomen was very huge and it was not taking any fluids. At least you can see. It was not taking any feeds. After 2-3 days, that mice was dead. It was happening to one male mice. Then I realized, okay, that one female mice we thought of pregnant, and now this is male mice and abdomen is distended. Then that is that mice also that is died. I opened that abdomen, that intestine, everything is distended. You have taken an X-ray, that is I will assume the same finding that is the intestinal subacute intestinal obstruction. So this why I am saying that. So these gastrointestinal epithelium will be that is within 24 days it will be regenerated. So that cell phone radiation, yeah, I am exposed to cell phone radiation that may cause that is the inflammation in the gastric mucosa. And the finding also typically same, it is coming thrice I have done, thrice also it is a lymphocytic infiltration. Just I cannot present that because only one, it may be due to a stress and loss of sleep and in research, maybe stress, but I believe that it is due to cell phone radiation. That is. Those who are having loss of sleep, early Alzheimer, maybe anxiety, loss of sleep, loss of memory, it may be due to related with cell phone, excessive cell phone use, but we cannot prove directly that. Very good.
One more question, sir, please. Sir, have you found any clue of change in reactive oxygen species or any DNA damage which can happen?
The other studies we have done, that is the co-metastasis, to find out in my study, I started with the SDSP. In the other study, the 4G and the 5G we started, that is the co-metastasis, definite DNA damage. In the tissue also there. Similarly, that is the oxidative stress, that is the level of that enzyme level. Superoxide dismutase and TPX enzyme, that is the level is increased, indicating that definitely oxidative stress. This superoxide free radicals inducing that endothelial, not epithelial, that is the endothelial damage That caused increased water permeability due to what we are observed in the wild interstitium, that increased capillary permeability, maybe due to the focal hemorrhage.
Thank you.
Thank you.
Thanks.
So this mobile phone induced damage, what we have seen in your presentation, has it been published in any international journal of
Yes, a lot of our studies. I have quoted in the bottom.
like Lancet or JAMA?
In the Scopus, PubMed,
That are just the indexing.
Okay.
But journal in Lancet, JAMA, New England Journal of Medicine, in any international journal of repute, has it been published or it is just published in a newspaper article? Secondly, any mobile phone company hasn't done any regulation for its use or overuse or where to keep and not to keep, because the society is more, I mean, the alarm bell is more rung earlier in the society than in the newspaper. So my question is this only.
Yes, sir. That is, so far that is, we have published that in the international journals, but not in this Lancet. We have published in the Scopus. We consider that next
Scopus
one.
is indexing
Agency, okay, that is in the,
not a journal.
yes, sir. That is, we have published in that PubMed. Okay, that is also again in that, such a thing.
So my question is that, see, what you follow is Lancet or JAMA or New England
We
Journal.
will consider that, sir. Next, that is 4G, 5G is ready. Now we
And
will consider that.
secondly, if 5G was harmful, then why this Mukesh Ambani would have launched this 5G?
That is for पैसा के लिए है.
Nee, it is paisa ke liye, but society.
Society
Yes, sir.
Society is more important and government will consider more to society than to money.
We will consider publishing it that
And
like JAMA and
any
Lancet.
mobile phone hasn't come with any regulation.
So that is
or overuse
Mhm.
and where to keep it.
Yes, sir. There is no specific guidance that been given to keep the place. You can keep
Yes.
anywhere.
Yes.
Anywhere, it's up to your convenience. And another thing that is that, but the regulation has been given. The SAR, the specific absorption rate for each cell phone should be less than 1.6. But SAR has been, in each mobile it will be mentioned. When you are purchasing that SAR value will be mentioned, then only you can purchase.
There is a,
Specific absorption rate. For each cell phone it will be different.
but this has been.
Yeah, mentioned by each telephone company and
Not
it
in any
is,
journal.
no sir, it is mentioned by telephone regulatory authority. This cell phone SAR should be this level, below this level. That
How
kind
much
of.
hours, sir?
One
How
point,
much hours of use is equivalent to that SAR? I'm not aware of the any SAR technically, but how much hours of use is equivalent to that SAR which is given in the
no
mobile?
sir, SAR is not that is how many hours like that. It is, radiation is exposed to your body
But
for 10 gram of tissue.
that is again, it must be equivalent to some hours of use or how much hours.
So no restriction, that is, they cannot put a restriction, then all the telephone company will be closed and they have to go.
I need that answer. Thank you.
Thank you, sir, that is, definitely we consider about that.
अब इनसे इतना क्वेश्चन पूछेगा सब कोई मोबाइल फोन ज्वाइन कर
और हम लोग रोज यूज कर रहे हैं, पानी कम पीते हैं, मोबाइल फोन
So there is no time restriction was given, sir.
थैंक यू थैंक यू
Thank you, sir.
Thank you, sir, for the enlightening talk. So I would like to call upon Dr. Anuj Sinha, Associate Professor of Anatomy, to kindly felicitate sir.
Okay.
I would also like to request Dr. Anuja to kindly felicitate Dr. Sanjay Kumar Sinha. So, the chairperson for this talk. And also Dr. Rajiv Ranjan.
किसी को दे दीजिए, हम लोग शेयर कर लेंगे। अब ले लीजिए, अब दे दीजिए, उसको ना खोलिए। अब आप
Just a bit, on the head. Big thank you to our esteemed speakers and everyone here for the patient listening. So the oral paper presentations are still going on in the first floor. So if you would like, you can visit them. It's in the community medicine demo room. The posters which were presented in the morning, it's available in the dissection hall right beside this room. And kindly please feel free to go around the college as we are waiting for the poster presentations to get over and final results be calculated. Thank you. Paper presentations.
अब उसके बाद what is the next program?
So after that, there's lunch, and after lunch, the valedictory function. Yes. Yes.
Before lunch.
Before lunch.
अगर before lunch अगर GP meeting में जाता है, आप लोग खुद लोग दो प्रेजेंटेशन मतलब